For the acting officers, the case regarding Mr. Benson presents itself with a major ethical problem. For paramedic John, the proof of Mr. Benson's advanced health directive allowed for the clear operation of the directions in the directive. Once the paramedics were satisfied that Mr. Benson had been adequately provided for, Jenny verbally informed them that she was the health attorney and had power over Mr. Benson's health directive. Jenny, however, provided no legitimate proof of attorney, which may have allowed her to exercise power over Mr. Benson. This dilemma highlights the importance for paramedics to understand laws regarding patient capacity, treatment, and rights for the valid refusal of healthcare. In Australia, all adults who have rights to consent or refuse medical treatment. The only requirement to do this is that a patient is of capacity. It is presumed that all adults have the capacity, unless otherwise proven. In Queensland legislation, an adult is believed to have capacity if they are capable of understanding the nature and effect of the decision, freely and voluntarily making decisions about a matter, and communicating the decisions in some way. It is not to be assumed that a patient lacks capacity solely because of their age, disability, or the fact that the decision the patient makes is disagreed with by a health practitioner. Townsend and Lark discuss that there are three elements to a valid refusal: capacity, voluntary, and relevance to the situation. Once it has been determined that a patient has capacity, the decision they make is to be ultimately their own. Whilst patients will look to their family and friends for advice and support, it is important that the decision they make is theirs and not made to appease another individual. It was to be determined that a patient lacks capacity and is unable to make their own decisions. An advanced health directive can be utilised. An advanced health directive is a formal document that gives instructions regarding future health care. An advanced health directive must meet certain requirements, including that it must be written, signed by both patient and eligible witnesses, and signed and dated by a doctor. An advanced health directive outlines the medical treatment or health care that a patient may or may not want to receive. It also enables the patient to appoint a power of attorney and includes pertinent information that may impact the patient's health care, including medical conditions, allergies, and religious and/or cultural beliefs. Under the Guardianship and Administration Act 2000, if an advanced health directive is in existence, it is to be utilised to direct medical decisions, despite if the family's wishes differ. When considering the four ethical principles, it is clear that John is faced with a decision that is ethically conflicting. Firstly, Mr. Benson was given the right of autonomy to make a decision that he believed in his best interest. Mr. Benson acted with a clear understanding of his decision and was sound of mind to do so. Secondly, Mr. Benson asked not to be transported to hospital and receive further treatment. This is an ethical conflict of non-maleficence. Non-maleficence explains that as practitioners, we are ethically required to do no harm by activity or inactivity. The third principle of bioethics is beneficence. Beneficence is a duty to benefit others and an obligation to do good. However, knowing Mr. Benson's condition, it comes into conflict by both not transporting Mr. Benson and also accepting his advanced health directive. Finally, John has to respect Mr. Benson's wishes and treat him with fairness and equality. By John respecting Mr. Benson's autonomous decision, as well as the procedures of his advanced health directive, Mr. Benson was treated fairly, morally, and equally. GTN, however, should not have been administered, as it was contraindicated. Paramedics are required to uphold the four ethics principles of integrity and impartiality, promoting the public good, commitment to the system of government, and accountability and transparency. For a patient to provide valid refusal for treatment and transportation, the paramedic must conduct a Virka assessment to determine the validity of the decision. The first component ensures the decision is being made voluntarily, without coercion. The paramedic must provide information on the patient's condition, treatment, and risks so that they can make an informed decision. After the patient's refusal has been deemed valid, they must be informed with advice of future issues, safety, and well-being. In the situation where Mr. Benson did not give a valid refusal, an advanced health directive would be used to communicate his wishes for life-sustaining treatment. By respecting Mr. Benson's refusal, the paramedics conducted treatment within the Code of Conduct and legislation. An alternative path of treatment would be to follow the directions of Mr. Benson's daughter, Jenny. Jenny stated that she is the health attorney, and it is unclear if this means his power of attorney or statutory health attorney, both of which are negated due to Mr. Benson's advanced health directive. If Jenny was his appointed power of attorney, she would be able to make decisions for him if he did not have an advanced health directive, and he was deemed to not have capacity. Alternatively, a statutory health attorney is not formally appointed and is automatically appointed when the situation arises due to close relationship to the patient. However, a health attorney is not considered necessary when the patient has an advanced health directive in place. Therefore, Mr. Benson's current state, Jenny is unable to override his wishes. Practitioners must use legal regulations to support all decisions. This involves liability and consent alternatives. In common law, all patients have the right to personal autonomy and respect when receiving and making medical care decisions. This includes the right to refuse causing withdrawal and withholding of life-saving treatment. If clinicians reject patients' decisions without just cause, they may be liable. If a patient loses capacity and is no longer able to provide consent, a substitute decision maker may be appointed to overtake liability for healthcare decisions on the patient's behalf. Clinicians should always advocate for the patient's known wishes to ensure good medical care and respect for patient rights. The Power of Attorney Act 1998 has established a statutory scheme where individuals, while of capacity, are able to complete an Advanced Health Directive document. An Advanced Health Directive provides written consent and protection to support clinicians withdrawing and withholding certain life-saving interventions. Upon evaluation, Mr. Benson presents with full capacity, allowing for the refusal of medical treatment by paramedic John. Mr. Benson's Advanced Health Directive, accompanied by his current unimpaired capacity, allow him autonomy to make his own decisions.